Good morning and welcome to the ILG webinar in regards to Families First Coronavirus Response Act, Understanding Leave Options. My name is Alicia Adolph and I'm the Professional Development Manager for the Association of Counties. Members from our various local governments met to put together today's important webinar. So in addition to the counties, we also want to welcome our friends from the cities, parks, and other local government entities that are joining us today. I have just a few quick announcements before we begin. You should all have a chat box where you can type your comments and questions. And at the end of the webinar will simply close and a very short evaluation will pop up on your computer screen. And we ask that you give us your feedback, which is greatly appreciated. Today, you're going to hear from NDACo Legal Counsel and Assistant Executive Director of Policy, Aaron Burst. Also, Williams County HR Director, Helen Ascom, as well as Eide Bailey partner, Brian Stavanger, and Senior Manager, Christy Rance. So with that said, let's get started. Again, I welcome all of you, and I will now turn the webinar over to Aaron.
All right, thanks, Alicia. This is Aaron Burst here at the Association of Counties, and welcome to a beautiful Friday. I hope everybody is safe and sound and has a great weekend coming up. This has been a real crazy time for everybody, and including the U.S. Congress, who put together a bunch of new HR rules that are required for us. Before I really get started on the overall background, in addition to the folks that are doing the presentation, I have to give a shout out to Stephanie Dassinger at the League of Cities, Amy DeCook at the schools, Desi Calahoo at Dunn County HR, who really helped me at least start putting some of this together in my own brain. As you can imagine, the U.S. Congress has passed now three what I would call stimulus bills. Really what we're going to be talking about is what was found in stimulus number 2, which is the Family First Coronavirus Response Act. There is a lot to those bills. They were thousands of pages long. And quite frankly, this has been one of the more frustrating legal exercises I've had to do, which I think goes to the principle is generally you shouldn't try to legislate during a crisis because as you're in a hurry to push things out, there was a lot of contradictory language, and it took a long time working through kind of talking through this, not only with a bunch of folks that I named, but just on the national level. And even the U.S. Department of Labor has recognized there's some conflicting pieces of the law, but we're all starting to kind of congregate and get a good idea of how to generally handle this. Of course, I always have to give the disclaimer that there will be some legal questions involved. There will be some things that don't quite make sense. Obviously, I can't give you legal advice. You're going to have to sit down with your legal counsel and HR for your local jurisdiction and try to work through some of these things. The second kind of point I always like to make is all HR law that is driven by the federal government, whether it's the Fair Labor Standards Act, FMLA, now the Coronavirus Response Act, those all provide the minimal protections for employees. There is never anything wrong with an employer being more generous what the federal law requires. So when I talk about 2/3 pay and those things coming up, just keep in the back of your mind that as an employer, that is what minimally you have to do. But if you choose to treat your employees better, that of course is legally acceptable and is a policy decision your local policymakers will have to make. So with that being said, we'll just kind of jump into some slides, and as Alicia said, we'll gladly take some questions. Hopefully we can get some time at the end here to go through some of the stuff. Again, now this is, for a while I heard a bunch of folks going back and forth, but I want to make absolutely sure, and I should have changed this slide to say all local government, all government in general, all of these federal laws will be applying to government. So everybody who's on the phone here who's involved in government, these laws apply to you. There was some uncertainty for a period of time or information that was coming out. And for those of you who also have a foot in the private sector, there are exclusions for private sectors. Very small companies will not have to follow these laws. That's generally 50 and under, and very large companies, 500 and over, will not have to follow these laws. But make no mistake, these do apply to all of the local governments on the phone today. So there really is two changes. Oh, by the way, I should mention this too. The feds in these changes for the private side did provide tax credits, so essentially reimbursing some of these law changes to the private sector. However, and this was a bit of a frustration for a lot of us in the local government, there is no reimbursement for these mandates to local government. There has been some talk with the stimulus number 4, which is being kicked around in Congress, which seems to have stalled a little bit right now, that there would be an attempt for local governments to try to get written into some of these changes. But as of right now, this is what you could generally call an unfunded mandate. And let me say one more thing too, regarding the employees. Your employees are by far and away your best assets. It's not your motor grader that you have that's worth $250,000. It's the employee who drives that motor grader, which is by far and away more important than any piece of property that you as a local government can own. So when I go through this, I always want to focus on, you want to make sure you treat your employees as fairly as possible, because obviously this is a difficult time for you as a policymaker, but it's probably even more so a difficult time for them as they're trying to go through this also. So again, back to what does this law really do? What are the main things that we need to be concerned about on the HR side? And really there are two changes, as you can see up on the screen here, that the federal government allowed. Really, the first one is what we call the Emergency Paid Sick Leave Act, which gives essentially all employees of the government an additional 80 hours of what could be termed sick leave if they meet certain criteria. And we'll talk about some exemptions later because I'm getting a lot of those questions. But generally, the rule will be there is now 80 additional hours that you must provide folks if they meet these certain criteria. And then secondly, they expanded what we already know is the Family Medical Leave Act. The Family Medical Leave Act has been on the books for quite a number of decades now, which gives certain employees the right to take up to 12 weeks of essentially medical leave for dealing with certain issues. The Family Medical Leave Act under the federal law is unpaid. A number of states have moved to making it paid. In North Dakota, FMLA is still an unpaid allowance for your local political subdivisions. The Emergency Medical Leave Act, again, will give certain employees the ability to take those 12 weeks off, but the big change is it now provides that is paid time off. But as you can note on the slide, it requires a 2/3 pay for the individual. A couple other things to think about here. For the emergency paid sick leave, the 80 hours, there is no requirement that the employee be on staff for a period of time. If they are an employee of yours, they qualify for the 80 hours. Under the Emergency Medical Leave Expansion Act, those individuals are only eligible to take that 2/3 pay if they have been an employee for 30 days. And again, that is, I'm giving you the bare bones law. If you want to give the Emergency Medical Leave Act for somebody who's just on staff, that would be fine because you can always treat the employee better than what the federal law requires. Okay, so the next slide here is what actually the new categories that were created. The federal government created 6 new categories of these, what is called paid sick leave. I really tried to break, when you go through them, you basically look at 1 through 4. Excuse me, 1 through 4 has been, oh, I got a little bit of feedback there. 1 through 4 is what I would term where somebody is being directly impacted by the virus itself. Either they get sick or they're taking care of someone who's sick. And then number 5 is the oddball. That is where nobody is sick, but because of the school closures or the daycare closures, those folks are going to have some additional time that they have to be with the family to take care of their children. And then number 6 is just kind of what I would consider a catch-all that the feds gave the Department of Human Services the ability to make some certain decisions on who also should qualify that is not in here. So let's just go through again the Emergency Paid Sick Leave Act. Again, categories 1 through 3 is basically if the government says you are ordered to isolate. Now, I get this question a lot from folks. Currently in North Dakota, as everybody knows, there are certain businesses that have been closed through executive order. There's been requests that people stay at home generally to isolate, to social distance. Those are not what is entailed in Category 1. Category 1 is when you have been specifically ordered to stay home. Either by the government or through a doctor's order. So if the doctor says you have COVID, you can't leave the house for 14 days, those folks would be into the Category 1. Now, as you can see there, those folks, again, if you fall in Category 1 through 3, you are entitled to 80 hours of paid full wages. So again, if you have been ordered by the government that you must be home for 14 days, you would get your full wages. However, the federal government recognized that they didn't want to essentially have millionaire employees, which obviously nobody does in local government, but they didn't want to have large wages being paid to somebody who's been ordered to be staying at home. So they did put some caps on that. So that's $511 a day. I haven't really done the math in my head. I don't know if there's going to be too many of those who reach those caps in the Category 1 through 3. So those who are sick would probably end up getting their full wage. If you drop down to then Category 4 and 6, 4 and 6, those I break out separately because again, those are the general catch-all, or caring for somebody who's been ordered to be isolated. Those again are entitled to 80 hours, but those individuals in those categories, if you yourself are not sick, but you're taking care of someone, those fall into what is called the 2/3 pay cap, the 2/3 pay. So those 80 hours of sick leave, you do not have to reimburse them the 100% of their salary. Again, if you look at the cap though, there is a $200 a day cap with a $2,000 total. So obviously 80 hours is basically a 2-week, 5 days for 2 weeks. And I do think we probably will have a number of local political subdivisions that do have employees that will reach that cap. I'm guessing there may be some, but this is important to remember. The federal law allows for the employee to supplement that 2/3. So let's say you have an employee that falls in that Category 4, you're taking care of somebody ordered to be isolated. You would then reduce their pay to 2/3. However, if the employee says, I do have previously built up vacation or sick leave, the law allows you to say, okay, we will pay you your 100% salary, but then you only get 2/3, which again, the ballpark math is 5.5 hours will be paid out of this emergency sick leave provision, and then the other 2.5 then comes from your vacation, and we will dock you your vacation or sick. Or, but you can't force them to do that. The employee might say, I'm comfortable with just taking 2/3. I don't want to burn my vacation or sick leave, and that's fine too. I'm guessing most people would still say I would supplement the workload so I can still get 100% of my salary. If they don't have any vacation or sick leave, then of course they can't supplement it, and then you would knock them down to the 2/3 pay. Now here's the one that I anticipate, I hopefully anticipate this is more of an impact than the others, because the others, of course, you're sick, and I hope we don't have a lot of COVID positive people in the local government. But I do see this as being a significant category because, of course, everybody who has kids, all the schools and most of the daycares have been closed. So really, you're probably going to have a lot of employees that fall, at least meet the Category 5 criteria. The Category 5 criteria, as I mentioned before, is if you are watching somebody who's under the age of 18 due to a school closed or daycare being closed, those folks are also entitled to 80 hours of essentially expanded sick leave. Again, those folks also have the 2/3 pay cap. And again, those folks are also entitled to supplement that with any previously earned vacation and or sick leave. This gets a little more complicated than the other categories, because this is the second part of the COVID Response Act, is the expansion of the Family Medical Leave Act, which, as I mentioned, now lets you take those additional 10 weeks, so 12 weeks total. You do the 2 weeks for the first 80 hours, and then the additional 10 weeks is again allowed to be paid at 2/3, where before the COVID response would be an unpaid leave. So that is, again, as you can see, still capped at $200 a day, but now your threshold goes up to $10,000. So we probably will have some folks bumping up against that 2/3 pay. Now here's a real interesting question, and one that I'm getting quite a bit is, well, let's say the person has a 17-year-old that's, for me, for example, I have a 17-year-old, totally functions by himself. School's closed. He's just sitting now drinking Mountain Dew and playing PlayStation all day. There really is nothing that I need to do to watch him to make sure he doesn't hurt himself or whatever. He can feed himself. So there is a question, well, could the employer, could the government tell that individual, no, you still have to work? And the answer is yes, you actually could. And in fact, there's an IRS form that says if somebody does take this sick leave to watch the kid, they have to essentially fill out a form that says they agree that there's nobody else that can take care of the kid, and they have to. Now, this is where I struggle a little bit. And I've done a number of emails to the state's attorneys on this, is that I can tell you what the law is on the practical side. Even though the employer could say, hey, you got to fill out this form and verify that you got to sit at home with your 17-year-old, I'm not sure as a practical matter that's really that enforceable. So again, if the individual swears that they have to watch their 17-year-old kid, I don't know how you really address that issue. But again, you can say, hey, you really do need to make sure that you need this sick leave, and it's not just to go out and work out. I did give an example, though. If somebody said, hey, I absolutely have to watch my 17-year-old kid, and now you see that individual jogging in the park with no kid around during normal work hours, I think that would be a time you could absolutely talk to that employee and say, hey, you're taking this sick leave to watch your kid that you swore that you would be watching, and now it appears that you're not watching the kid. What's going on here? Again, that's going to be a real weird category that you're going to have to sit down with legal counsel and HR to figure out how you want to deal with that. Now, I should say most of the times that I think through these scenarios, I think that's the worst case scenario. I think generally most people want to work. They're not just going to use this as a staycation opportunity. Most people want to work, and I don't think there'll be a lot of people in local government trying to abuse the system, so they say. But that is, I'm guessing we'll get a lot of questions on this category coming up. Now, finally, here's a lot of questions coming in, and the federal government did recognize that there are going to be certain classifications of local government employees that should not be eligible for these extra 80 hours or these extra 2/3 pay category 5. And they said healthcare providers and emergency responders can be excluded. Now, again, I want to highlight that is can be excluded. If the employer wants to say, you know what, we're not going to make a distinction, we're not going to exclude our workers, we will give you all the same benefits, that's totally allowable. I probably would suggest, and I did a template kind of policy that Desi actually is the one who put the beginning stages of that policy together in Dunn County. I think there is going to be, you're going to have to exclude some folks from these laws, but I really think that should be a department-based exclusion. I would, again, this is just me speaking, I'd be hesitant to say you as a policy should just blanketly exclude absolutely everybody that you can, because the real world doesn't exactly work out when you have these blanket policies. But nonetheless, I would suggest your policy says that there are certain employees in your political subdivision that the department head may have to exclude. Now, the U.S. Department of Labor specifically names a bunch of those kind of employees, but says it's not limited, and so it really should come down to decisions by policymakers on who should be excluded. As you can see, the exclusion basically tries to target folks like law enforcement, nurses, doctors, those folks you can't have take off 80 hours of sick leave when they need to be taking care of patients or making sure the people are safe. And so there are certain excluded employees. Now, again, I think there might be some certain employees that you have that may be excludable, but because you recognize their value to the organization, you recognize they have some unique situations, maybe you might want to allow them to take that exclusion. I've been talking to a number of social service directors, and as you can see here, the child welfare workers are specifically excluded. But how do you categorize the receptionist who helps those child welfare workers? Are they part of the skill set to keep the operation running? Those are very difficult decisions that I think you're going to have to do on a case-by-case basis. And so motor grader operators, public work personnel, you could exclude them if they have to keep the water running to houses. Those folks could be excluded, but again, whether you want to do that or not is going to be up to you. And so really that is the last slide that I have in terms of the general 30,000 foot level view of this, but I do want to drag over here. This is the U.S. Department of Labor, and they have a lot of material. Of course, they're going to have some posters that you have to post in your political subdivisions break room or whatnot, but there is a lot of question and answers, and it has been fairly helpful to me to work through this. But I would refer you back to some of these. There will be some questions that still cannot be answered, and then that would be for your legal counsel and HR division. So with that, I would gladly turn it over to Helen in Williams County. So thank you, and I'll take questions at the end.
Okay, sounds good. Thank you, Aaron. This is Alicia. I'm just going to turn it over to Helen's screen. Helen, something should pop up on your computer.
Yeah.
All right, you're ready to go.
Thank you. Helen Askham, Williams County HR Director. Let's see. We'll do
No
it this way.
problem. Okay.
Yeah, that'll be okay. So a couple things to add to what Aaron said. First, let's talk about that 2/3 pay calculation. Working with our finance department, this is what we have decided we're going to need to do. We are not, well, let's go back. So somebody who takes a day off, they're going to get 2/3 pay for it. In terms of what's coming out of their FMLA balance or out of their even EPSL balance, it's 8 hours. They're taking 8 hours against that total 480 hours of FMLA time. But in order for us to calculate if they hit the maximum for the day, which might be $200, and to determine what piece of that should have been covered by sick leave, we're actually doing the math as you would see on the top of this screen, which means it is calculated after we've calculated pay. So we aren't saying 5 point whatever hours of EFMLA and then X number of hours of sick leave. We're doing the math after pay is calculated because you have to capture that $200 maximum first. And in fact, the full 8 hours should come out of their EFMLA benefit. And the fact that they're supplementing with some other sort of pay happens after the 8 hours have been deducted. So if there's more questions about that, maybe not on this call, but you could email me separately and we could talk through how our finance department is handling that. The other piece that I will say is that there is this chart that the Department of Health put out, and we're lucky to have a close working relationship here with our Department of Health, our district health unit. And so we've had some conversations with them about how are they going to track close contacts and how would that impact our employees. And so I give this to you just as a reference. I don't know that they have it on the website, but the Department of Health Facebook page actually posts a lot of really good, helpful graphics. So I'd encourage you to go out there. So what this shows is that someone who is a close contact would be, by Department of Health guidelines, asked to quarantine or isolate until a test comes back positive or negative, and if the test is positive, they'd have to isolate for 14 days. So we started to think about how this impacted our departments and our employees. At Williams County, we continue to have a number of people coming to work. We have those law enforcement and first responders. We have folks working in the court system. We have folks working in social services. And frankly, we're trying to pull off an election and do some work related to property valuation and equalization. And so in all of those cases, it is required that sometimes our folks are coming into buildings, they're coming into contact with each other, and we wanted to make sure that we didn't accidentally shut down a whole group of employees because we were unaware of how the Department of Health was going to handle a quarantine. So what we've done here is we've made sure that everybody is working at least 12 feet apart, because what we've been told by the Department of Health is that a close contact definition at this point is 12 feet within 12 feet of each other for 10 minutes or more. And so we are encouraging our employees to stay 12 feet apart, and we are encouraging them to limit any discussions that would be in person to 10 minutes or less. And you know that this isn't always practicable, and certainly there are some exceptions, but the idea is we hope that everyone is healthy and we hope that no one is spreading illness from one to another. But if they did happen to get sick, they're going to look back, the Department of Health is going to look back 48 hours, and they're going to say, who have you had close contact with? And if it ended up to be everybody on their shift at the sheriff's office or everybody in the child protection unit at social services, we unfortunately would have all of those people asked to quarantine at home. And you know that there are some exceptions to that, but we wouldn't necessarily want to impose that kind of exception where we think there could be illness being spread unless we really had to. So if you have people working, this chart has been really helpful to us also because we've had a lot of questions about my child goes to a daycare, and a dad, if someone who's at daycare works with somebody who's sick, should I make my employees stay home? And so this chart also, not on the red section, but in the green and blue, I think helps us to make some decisions about how worried we should be as a human being, but also as an employer. The other thing that Williams County has done is that we have created our own little checklist. So we have the 6 qualifying reasons for leave that Erin talked about, and then we've actually created 5 more. One of they relate to travel isolations or even the more strict isolations that decisions that we're making in some departments. I would encourage everyone, no matter how big or small your organization is, to think about functional unit, not your organization as a whole. We are certainly handling things differently at social services and the sheriff's office than we are in the administrative offices. We know that social services and the sheriff's office, and especially the jail, has to continue to operate no matter what happens. And so we're being more careful and more thoughtful about allowing people to be gone if there might be a reason that their health would be compromised and it might spread throughout a shift or spread throughout a unit of an agency. And so we've created another sort of classification where we are being more generous. We're allowing our employees to use that 80 hours of EPSL. If we as an employer decide we don't know for sure that you're sick, we don't know for sure that you've actually been exposed, but to err on the side of caution, we're going to have you stay home. An example would be we had an employee whose father came to visit from out of state, was fine while he was here, got back home, and within a couple of days tested positive. Well, if you look at any chart, and it was early in this saga, there was nothing that said he should for sure stay home. But we decided, because he worked in one of these critical agencies and because he would typically have close contact with a number of people on a shift, that we would have him stay home for the 14 days. We made that decision. It doesn't qualify under any of the 6 categories, but we've created our own cheat sheet of these other categories, and we are trying now to go back and do a nice narrative and some thoughtful documentation of why people were off and why we made the decisions that we did, because it looks to me like out of 330 employees, we're going to have hundreds of incidents, some of them happening to the same person in multiple ways, but many individuals who end up with an adjusted schedule, who end up staying home, who have a complication. And we want to be able to go back later and understand what that is. We're also tracking on a spreadsheet a reason for a person's leave by payroll, because as Erin said, if there's additional legislation that will allow us to receive reimbursement, we want to be able to run a spreadsheet by payroll that says this person was off for qualifying reason 1, this person was off for qualifying reason number 4. We are putting a little effort into getting the documentation that it will take, but quite honestly, until we know that that's worth the effort, we're not pushing too hard with employees to do that. I do anticipate, related to FMLA, we do have some folks who have already exhausted their FMLA, folks who have had maternity leave in the last 12 weeks or in the last 12 months, and those folks are eligible for the EPSL, but they are not eligible for the additional FMLA coverage. Now, let me just remind everyone that FMLA protects an employee's job and protects their benefits, if we want to have a broad overview. I would say at this point, we aren't looking to terminate employees because they have to be gone and they're outside of FMLA protections. But I think we all have to be careful that as we apply some exceptions to what we might usually do when someone must miss work and is now outside of FMLA protections, I think there should be some clear documentation in your records that the COVID crisis has guided you to do something different than your norm, because we all want to be able to go back to our norm once this is over. One final thing for me, and this just popped up this morning as I was looking, the president rolled out an initiative for how we might be able to quote unquote return to the normal world. And one of the things that is defined in this web page that the White House has put out is a list of what it would mean to be a vulnerable, let's see if I can show it to you here. What it is to be one of the vulnerable people. And my concern would be, everyone, that I think almost everyone we know would be defined as a vulnerable individual. So you see that it lists health conditions, high blood pressure, chronic lung disease, diabetes, obesity, asthma, immunocompromised. And part of what this White House documentation says is employers should continue to provide protections for vulnerable individuals who they employ. And I'll tell you that I have asthma and have my standard spring asthma cough right now. And I do think we're going to have to hold a line to a certain degree, because we are going to need people to continue to work, and we need to value our employees and treat them fairly and honestly and carefully. And on the other hand, if we regard them as having a disability, then under the ADA, I think we step into tricky ground. So be thoughtful and careful as people tell you, I have an underlying medical condition and thus I need, whatever accommodation. Know that we're going to have I think, a really fine line to walk. That was my list of notes. I will hand it off, I think, to the Eide Bailly folks, and I can have questions later as well.
All right, thank you very much. This is Brian Stavinger. Christy Rance is also on the phone. Thank you, Erin, for your wonderful summary, high-level summary of the sick leave and FMLA. Not much more to expand on that, other than to, I guess, reiterate the fact that there are so many nuances to that just make sure you're engaging in good conversation with your legal counsel, your auditors, your representatives at various agencies across the state, just to make sure you're doing that correctly. Helen provided a good example of, I guess I should go back to Erin's comment that currently there is no reimbursement available to local governments, state governments. These are required to be followed. There is no compensation to doing so. Helen provided a good example of keeping track of this just in case, the scenario where potentially in this fourth stimulus package, or maybe even another one in the future, that there will be some reimbursement available to government. And if that's the case, what I'd like to do is just have Christy hop on here and provide some examples of how to keep track of that, just in case you'd be allowed for reimbursement. Christy?
Good morning, everybody. So Are you guys getting feedback?
Yes.
Oh,
We must be coming through your computer or phone as well as you're talking.
let me get out of the website or the presentation and see if that helps. Is that better? Alicia?
Perfect.
Okay, I was watching the webinar at the same time, and that doesn't seem to work.
Thank you.
Yeah. So anyway, we have reiterated some of what Aaron and Helen have talked about, but some of your softwares probably have pushed out some separate pay codes for COVID. I don't know if you've noticed them. I know QuickBooks has pushed out pay codes that are used specifically for the COVID. And we've also seen some other softwares. So if you haven't seen that, make sure you check with whatever your software provider is to see what those pay codes are. If you set them up yourselves, I can just name a few that we have seen. One is National Paid Leave for the Employee or COVID-19 sick pay. And that's the one that's for the employee, and those first 3 bullet points that Aaron talked about that they're subject to quarantine or isolation because of COVID-19, or a healthcare provider to self-quarantine, or they're experiencing symptoms. So we recommend that you do set up separate pay codes for those, because we just do not know what type of reimbursements will come down the pike. We also have seen for the second 2 weeks for sick leave for quarantine or isolation, because you've been advised or because of your children. We've seen set up national paid leave or COVID-19 2/3. Those are just some separate pay codes that you should set up. And also for the FMLA portion, we've seen wording national paid leave FMLA or COVID-19 FMLA. We just really feel like we should set all of those up separately so that we can keep track in case of the reimbursement. And also national paid leave for health insurance, because we don't know if you will also be receiving some reimbursement for health insurance. And also with these, if your system will allow you to set up some kind of cap, so you don't have to manually keep track of those, that would be helpful also. So for the sick leave portion, if you can cap at 80 hours, and for the family leave for the 10 weeks, that would also be helpful, just so you can keep track and don't have to do everything manually. I think those are really what Brian and I wanted to talk about, and hopefully there will be something more coming down the pike for information for governments. So Alicia?
Okay, fantastic. Thank you to both Brian and Christy, as well as Aaron and Helen. You guys have covered a lot of information. Now we will take questions. Now's the time to use your little chat box to type in any questions, comments. Maybe there's some information you need clarified even after you've heard it presented. Just a friendly reminder to the presenters to please mute and unmute your microphone as you participate in the Q&A. So first question, it reads, While I understand that government employers will not get a tax credit for wages paid under the provisions of the Families First Act, it appears that governments do not have to pay FICA taxes on the paid leave under this act. Can you confirm this? Just a reminder to unmute your mic. I'll read the question one more time. While I understand that government employers will not get a tax credit for wages paid under the provisions of the Families First Coronavirus Response Act, it appears that governments do not have to pay FICA taxes on the paid leave under this act. Can you confirm this?
This is Brian Stavanger. We actually just had this question come up earlier this week. I've got quite a lengthy response that we received from someone who did some research on this. And And I apologize for not responding right away. I was trying to track down the email. So the response is that a governmental employer required to pay FFCRA leave wages would be eligible to exclude payment of the 6.2% FICA tax on those wages paid. This does not apply to wages paid in excess of the leave requirements. Does that answer the question?
Thank you, Brian. If not, or you need a little bit more, just message in, but I think that should be sufficient.
Alicia,
Okay. Yep.
this is Helen. Can you get something, Brian, can you put something together for us in writing? And then maybe could you all send that out to the HR folks and the auditors so that that's a universally known bit of information?
Yeah, and what we're doing here at Eide Bailly, we had a town hall webinar yesterday that I know some people on this call participated on. We are going to issue, following that, we're working on an FAQ document. So we will try to get that polished up and then make sure that the proper leadership for this call get a copy of that and can distribute appropriately.
Thank you, Brian. Okay, next question reads, I have read under the IRS guidance that the care of a child older than 14 during daylight hours requires a statement that special circumstances exist requiring the employee to provide care. Is that correct?
This is Helen. I'm unaware of a specific IRS guideline. Maybe the Eide Bailly folks will know more about that. I certainly know that social services agencies and the like have certain guidelines for when children can be left home and not left home. I think that I would echo what Aaron said when he started, which is if staff come to us and say, there are circumstances at my house that mean my older child requires some supervision, and maybe that's just because they're rowdy and they're not willing to follow the social distancing and the stay home guidelines that we received from the governor. I think we need to work with our employees right now to make sure that we're doing what we can to help them juggle the challenges that they have at home and the challenges that we have for them at work. And if that means they have an adjusted schedule because that child is sleeping until 11 a.m. and so they come in and work and then they come in late in the day because by then their spouse is home, try and make accommodations. Aaron did more research on the specifics of the emergency FMLA. I think it's age 18 there, isn't it, Aaron?
Yeah, that's right. 18 is the age that the law allows you to get the Expanded Family Medical Leave Act and the 80 hours. Again, that's where, as a practical matter, I do see, at least theoretically, a break between what would normally be expected versus what the law allows. Again, going back to my example, if I went to Terry Trainer, the director of the Association of Counties, and said, I need 80 hours off because I have kids who aren't in school. Technically, the law allows Terry to say, I'm not sure if I agree with that. I know your kids, they're all fine. But again, the practical implementing him saying no is very difficult to do. Again, most employers and employees are going to have a good relationship where you're going to work through that. You could take it in different parts. So again, you could say, well, I need to be here to get him out of bed or whatever, and maybe work with him on some of his projects because he isn't a very self-motivated individual. But then I will later on go back and come into work a little later. I think most of those problems can be solved, even though in theory it's not clean. Yeah, so I'll leave for questions.
Okay, thank
This
you.
is Christy from Eide Bailly. Oops, I'm sorry, Alicia. This
Nope,
is Christy from Eide Bailly, and I have not seen anything on the 14 years of age either. The only other thing, and I don't think that we mentioned it is they can be above 18 if they have any type of, they cannot care for themselves due to some kind of disability. I don't know if we mentioned that anywhere.
No, I didn't, but thanks, Christy. That's absolutely correct.
Okay, next question. The League of Cities suggested city and county employees work 1 week on and 1 week off. If employees opt to do this, should the entire family be quarantined, and should they be paid based on these new policies?
Oh, go ahead, Helen.
Well, I would say first go look at that Department of Health chart, which really says secondary contact is not what the Department of Health would say where we need to focus our quarantine orders. And so right now I'm coming to work every day and working in the office. And so are a number of people that work in the building with me. We all have contact with our family at home, and certainly some of those family members are also going to their job and coming back. But we can only control so far. And in our conversations with the Department of Health, it is actually more important to talk about social distancing. Remember, it's 12 feet. I would say for employers, we should be trying to be 12 feet apart, not 6 feet apart, and limiting the amount of time that people spend together, making sure that people do not come to work if they have any inkling that they might have a fever, which seems to be one of the primary indicators of COVID-19. As Aaron, I think, will say, we have the ability to ignore in some ways. We have an exception to some of the quarantine rules, but some passing possibility of exposure shouldn't mean that we force people into 14-day quarantines.
Yeah, again, the only follow-up I'm going to have on that is the law is fairly clear that the employer can still require the employee to work. So a lot of these hypothetical questions, we don't even have to get into the Family First Coronavirus Act, because you can say, hey, if you can do your job online, email 7 hours out of the day, and only come into the office 1 hour to pick up the mail, that is completely acceptable. And the employee, you could say, you don't need to take 80 hours off, you can telework. So that is a way that most of this can be addressed. Now, I do recognize there's going to be some jobs that you just flat out can't do without being physically present. And then those would be the jobs that we're going to have to explore whether they fall in one of those categories.
Okay, next question. Can employees legally be paid at the on-call rate?
I think what that question is getting at is there are certain employees that you say if you have to work on the weekend or be at least available on the weekend in case the sewer plant goes down, and we're going to give you a certain benefit for that. Can you legally do that? Absolutely. Does that fall into one of these categories? I wouldn't think so, because that really is a benefit the employee is getting. I don't know how to necessarily answer that. I would have to get a little more detail on how you're treating that employee.
I would think the answer is you can always be more generous as an employer, but I would be concerned about opening a can of worms that you wish you hadn't. And so is everybody who's working in every department under whatever circumstance all going to be paid an on-call rate? And maybe the question is about someone who isn't working. We do have a department, we have the DMV office in Williston, and we had to close the office, and frankly, there's 5 people and there's just not enough work to keep them all busy when we can't accept the public into the facility. And so we have been for a couple of weeks paying 2 out of the 3 on a rotating basis, even though they're not coming to work. And now we have some work available in support of the auditor's election effort. And so we have those two people or a series of two people from that department sitting physically distanced more than 12 feet apart. Now they're back to coming in every day, and they're working to support the auditor's effort. So you might be paying people to stay home and not work if in fact they don't have any work to do by your choice, just like when we close a building or some other employer driven reason happens that they can't come to work.
And just one more thought on that too. When you look at all of the law, you're supposed to calculate if you're giving them that extended sick leave, that's supposed to be your regular rate of pay. So it's not that you, if somebody did some overtime last week, you don't add in the overtime to their rate of pay for the sick leave. Essentially what Congress was trying to do is nobody should be coming out ahead of where they would have been regularly. They should be getting their same salary and just allowed to take that sick leave. In essence, those first three categories are telling you, or first four categories, I should say, are telling you, regardless of whether you have sick leave built up from your employer previously, we want to make absolutely sure that if you're sick, you shouldn't have to worry about still coming into the office and getting everybody else sick. But you shouldn't be making double your salary because of some way to work the system, I guess.
Okay, thank you. Next question. Is there a chance we can get FEMA reimbursement for Emergency Paid Sick Leave Act and Emergency Family Medical Leave Act Expansion Act?
We can explore that. I am at some point, as everybody knows, the state received about $1.2 billion. There is going to be certain discussions that we got to have on how that money is going to be spent. That's a lot of money that has to be spent. That might be a possibility. As of right now, I would say I don't foresee that happening, but I can't. I really want to thank Christy, Brian, and Helen for raising the issue. You should be separating this out in case that opportunity comes. It's going to be impossible to go back months later and say, hey, we spent 10,000 man hours on Corona response. If you can document it, at least you have something to make your argument with.
Okay. Looks like we have some questions for category 5. If 80 hours were previously taken for reasons 1 through 3, 4, and 6, are the first 2 weeks of category 5 unpaid or supplemented with previously earned sick/vacation? And also, are the first 10 days unpaid or not under category 5?
Yeah, so that was one of the biggest headaches that I had working through this. When you specifically read the law, the first 10 days for the category 5 says unpaid, but then the additional reading of the law, and essentially the Department of Labor says you have to blend them together. The first 10 days, in my opinion, is going to be paid at 2/3 pay. Under the 80 hours vacation rate. It could be unpaid under the family medical leave expansion, but again, you're going to supplement that with the 80 hours for the expanded sick leave. And I almost have to write it down, your question specifically with the example to figure out how that would work. What is clear on the law is these benefits are in conjunction with the other benefits. So again, as Helen mentioned, if you have an employee that's burned all their FMLA at the beginning of the year, say they had a child and they took all their FMLA off, then your 2/3 pay FMLA expansion isn't going to apply because you have no FMLA available anyway. So there are certain scenarios where, because you've already exercised your 80 hours, let's say you used your 80 hours because you had COVID, and now you use the FMLA expansion portion, you might not be able to get I almost have to just specifically read your question. There is a possibility you could deny certain portions of the pay and go to unpaid. Again, if I can't, I want to
Hello?
stress enough
Aaron,
is
I
that,
think we might have lost you if you can hear me.
that's, hello? Hello? Can you hear
Helen, can
me?
you hear Aaron talking? Okay.
I
Can
can
you,
hear Aaron talking.
I can hear Aaron.
okay, well, it was the most brilliant answer I've ever given in my life. So for those of you who didn't hear it, I need some respond back to them, Alicia, that specific questions I'd have to work through with them. Regarding the 80 hours, they're pre-August, pre-April 1. Those didn't go into effect. But when I was talking about the FMLA, the FMLA is a year-to-year basis. So if you didn't have any more FMLA at the beginning of the year, you might not get the FMLA benefit under this expansion. This only expands the FMLA to get paid. It doesn't provide more FMLA.
Thank you, Aaron. I'm back. All right, next question. If an employee can work from home, but not as efficiently, do we treat them as still working? And can the employee refuse to work and take the Emergency Paid Sick Leave Act?
The answer is absolutely. If they are working, whether it's at home or at the office, that is hours worked, and then this becomes a moot issue. If someone says, I absolutely refuse and I have to do the 80 hours or the Expanded Family Medical Leave Act, again, as I mentioned before, there is a possibility the employer could say, no, you need to still work. But as a practical matter, if they make a clear demonstration that they fall in one of those categories, I don't see the employer how they could say, no, we're not going to honor that. That's the legal versus the practical implementation of this law.
Okay. Can you require employees to use their vacation sick time concurrently with the Emergency Family Medical Leave Act Expansion Act?
No.
Okay. Do exclusions include health department and social service employees if a department head says they fall under exclusion?
Can you read that one more time?
You bet. Do exclusions include health department and social service employees if department head says they fall under exclusion?
Because this is specific to social services, and social services is in a weird category of quasi-state, quasi-county, I need to do more follow-up on that. My general answer is going to be the department head is going to have to make some discretionary calls on who is excluded and who is not. Personally, I think secretaries in the social service zone, those kind of folks, although they're critically important to the operation, I don't think you're going to be able to exclude them. Now, the law did provide that the chief executive of the state, which is the governor, can make designations on who is excluded. I have not seen the governor make specific designations outside of what the Department of Labor has already put together on who they think should be excluded.
Okay, thank you. In regards to the reason number 3 for the 80 hours of sick leave, someone asked, if I'm coughing around people and told to go home, would I qualify since coughing is a symptom?
No, it has to be specifically ordered by a doctor to be quarantined, or the government quarantines you. If your employer, who is the government, just says, hey, we want you to go home, that is not ordered in terms of where you're subjected to by the force of law. If the employer wants to tell you to go home, I don't know, Helen, how would you handle that?
Yeah, we are in situations where we say to someone, it really, because we are trying to be extra careful in this department, and we don't handle it this way all of the time in every circumstance, but we say, if we're asking you to go home because we are suspicious of your symptoms, we're going to let you use the EPSL, the emergency paid sick leave, and we are tracking that not as a number 3, but in our list we call it number 8, which is one of the invented Williams County numbers, and we know that we are not going to be eligible for reimbursement for that, but we are trying to find this balance in encouraging people who might not be feeling well or who might not be well to go home, allow them to be paid and use a benefit that is hard to define, and yet expecting people to come to work and be productive when they can be. It's a hard balance to find, but we're trying to be as generous to our employees as we can.
And I just highlight again, the employer, if they're comfortable with that, I agree with Helen 1000%. Does the law say that you require some sort of order to quarantine? Yes.
Okay,
Oh, let
thank
me
you.
make a note. The other thing that we have done, and again, we're classifying these as a number 8 here at Williams County, is that we know there was a period for sure where our healthcare providers were really overrun with folks coming in with more flu-like symptoms, but needing assessment and maybe getting a COVID test. And so people who said, I know these are seasonal allergies, but I'm going to stay home just because I don't want to be patient 0 at the Williams County Courthouse, we are allowing them to use EPSL, even though they're not going to bring us a note that says they went to the doctor, because they were pretty sure that they weren't sick, but they were being cautious. We haven't seen really any abuse from our 330 employees of folks just trying to stay home because they don't want to be here. People have really been honest and hardworking for us.
Okay. Next question. We have many employees that are full-time, but their workday is 6.5 or 7.5 hour days. I would like to clarify. The emergency sick leave is for 2 weeks, not necessarily 80 hours, correct?
Yeah, great question. And I didn't put it in the slide because I sometimes forget about the temporary employees. It is 80 hours for when you look at it, it says 80 hours. It does say for part-time employees. So I suppose it depends on how you designate it, but part-time employees are on a sliding scale, and it's the average of time that they work over the 2-week period. So if you have somebody who works 20 hours and 20 hours, then their average is obviously 20 hours over the 2 weeks. So then they would be down to 20 hours of sick leave, not the 80 hours, but it is specifically the 80 hours. Again, the law says 80 hours for full-time, and then part-time is the average of the 2 weeks. If somebody comes back and say, yeah, I work 35 hours, I'm considered full-time in my jurisdiction, so I should get 80 hours, that to me is not clear. I think technically you could give them the 80 hours, or you might be able to make the pitch that no, you only get the 35, and so you get the 70. That is not clear to me, and I have not seen any clarification on that. Again, give them, if you're talking about taking 10 more hours of COVID because they're sick, I'd personally give them the 80 hours. But again, those very, very short time employees, I would not give the 80 hours.
Okay. I'm getting quite a few requests, Helen. We would like to share your information if possible with the attendees after the webinar. If you're good with that, I'll email everyone a copy of the information you've shared today.
Yep, no problem.
Okay, question. I have an employee that is from Minnesota and they are on a stay-at-home order, not because of a student. They have used the first 80 hours of sick. Now what? Do they need to use their sick or vacation? And when they say 80 hours of sick, that's the Emergency Paid Sick Leave Act.
They burn the 80 hours for watching a child? Is that the crux of the question?
Well, the employee's from Minnesota, and they are on a stay-at-home order, not because of a student. And they have used the first 80 hours of their Emergency Paid Sick Leave Act.
Okay, wait,
Now
Erin,
what?
let me jump in. So we have employees that live in Montana. Montana is, I think, or was on the hotspot list by the state of North Dakota. And certainly part of what the governor has said over and over is, even though these orders are in place related to travel and quarantining and staying home, we understand that some essential workers must, they live just over the border and they're going to come into North Dakota, and those are reasonable exceptions. So our folks that are driving in from Montana, we don't treat them as a traveler because we know that they're driving over a border, which is not a boundary that COVID-19 would see as significant, and they're going to their home, no different than me who drives 6 blocks to go to my home. So if this employee lives in Minnesota and is staying home merely because Minnesota has a differently defined way of dealing with COVID isolation orders, I mean, I would say you have a conversation about they should certainly be coming to work if that's your expectation, and you can provide a way for them to do that safely. The fact that they live out of state just over a border shouldn't make a significant difference.
Yeah, the only thing I would add to that is if you could exclude them, if they're one of those categories of employees, it doesn't matter. You could require them to work and there is no 80 hours. Assuming they're not an excludable employee, and the question essentially says that Minnesota said you can't leave. And so they would then be entitled to, because under category 1, they've been ordered to stay at home, they would be entitled to 80 hours. Once they burn that 80 hours, there is no more federal law that requires them to get paid. Obviously, they could then start burning their vacation or sick leave that they previously earned, but they are not qualified for the Family Medical Leave Act expansion if you're in category 1.
Okay. Thank you. Next question. If the employer sent an employee home since the employee was exhibiting COVID symptoms, does that employee need to contact their doctor and receive a diagnosis in order to be eligible for the Emergency Paid Sick Leave Act? Or can they be eligible for the Emergency Paid Sick Leave Act for just showing symptoms?
And that this has been interesting. I've had an interesting back and forth with a state's attorney in Trail County, Charlie. Generally, again, as you look at the categories are fairly self-explanatory. If you've been advised by the healthcare provider that you need to be quarantined because of a COVID, that qualifies you for the 80 hours. The question that Charlie Stock and I have been talking about is, can the employer demand that they bring in the essential doctor's note to say that they have some symptoms or whatnot? And when you look at answer 15 and 16 on the DOL website, it says the employee should provide the doctor statement, but it does not say shall. And so there's a debate on exactly how you document that. But ultimately, if indeed the healthcare provider told them that they need to quarantine, that would give them category number 2.
Okay. What is the IRS form for stating no one else can care for the child? What is the IRS form for stating no one else can care for child?
Yeah, it's specific. I have it. We can send it out to everybody. I think Helen has it too. There is a specific form.
I'm just making a note of that. Okay. Next question. Can the time off be sporadic or does it have to be concurrent?
Well, really, that's between. Um,
Aaron,
yes.
this is Christy from iBailey. I know that the category where you're caring for your child under age 18 or different areas like that can be sporadic, because we've seen cases where maybe mom takes morning off, dad takes afternoon off, you know, that type of thing. So under that area, it can be sporadic.
Yes, I agree with that. I was trying to think of all the categories. The categories are, if you have the COVID, you have to take your 80 hours because again,
Right.
you don't want them coming in for 5 hours if they have COVID. So that would, I would say the categories, the 1, the 2, the 3 are probably the 80 hours must be taken, but then the categories of 4, 5, and maybe 6 could be taken sporadic. There is a question answer that says that could be sporadic if the employer agrees to it.
Okay, thank you. Next question. Regarding the 6.2% employer share of FICA that does not need to be paid in, is there specific forms that we need to submit when we do our quarterly 941 forms?
This is Brian. I am unsure on the answer to that, but I will make note of it and follow up.
Thank you,
Brian,
Brian.
if I can just step in for a minute. Like, I'm not sure about governments either. I can tell you that in the for-profit world, it comes off their EFTPS right when the payroll happens. But I think Brian mentioned we'll have to get back to you on that, because it definitely could be different for government agencies.
Okay, thank you. Someone's just commenting in. I know we talked earlier, there was a question in regards to FEMA reimbursement, and somebody actually checked on the FEMA question yesterday, and the representative said no. So just a comment there. Just a few questions left. If an employee says they need to be home for children, but we are allowing alternate work schedules or allowing teleworking, can the employee deny those requests to work?
No, and that answer is fairly clear. The employer is still in control of the employee's schedule. It is only so again, if the employer says, "Hey, you absolutely can answer emails, even though you're taking care of your kid, you can answer emails and take some phone calls occasionally," the employer can say, "We're denying that leave." Now, again, that is the practical problem. If you have a situation with somebody who has a very demanding special needs kind of scenario, and the employee says, "Hey, I absolutely can't answer emails because of the high demand," I think the employer is going to have to take the employee's word for it. But the employer, in theory, does have the ability to deny and require an individual continue to work if they can do so teleworking wise.
And if they refuse to work, then they have to use vacation time. I mean, they can take vacation and
Yeah, that,
then they would be unpaid.
yep, that's great point. It's just like pre-COVID. If somebody has vacation and they say, "Well, okay, then I'm taking vacation," absolutely, they get to do that. We're taught if somebody didn't have vacation, refuses to work, and says, "Well, you still need to give me 80 hours," the employer could say, "You don't fall into one of those categories," or you could still continue to work, and then you got to make it. Then basically, that's not performing your job, and how you deal with that is up to you.
Alicia, can I come on to comment on the 941 for just a second from the previous
Yes,
question?
you bet, absolutely.
So, okay, so, you know, Helen mentioned and I mentioned that we want to make sure we keep track of each of these types of leave separately. At this point, we've not seen a 941. We've not heard what they're going to do. We've talked that they may even ask what type of sick leave you're taking these credits on. So that I just want to reiterate, it's very important to keep track of whatever sick leave you're paying. That's really all I wanted to say on that.
Thank you, Christy. Perfect. All right. Erin, you had that website for the questions, the families first, all those questions. Somebody is just referencing maybe if you could see number 31, scroll down to 31. And that is, it states that an employer may require employees to use any pre-existing paid leave after the first 2 weeks.
Say that one more time.
Yep, on number 31, it does state that an employer may require employees to use any pre-existing paid leave after the first 2 weeks.
Yeah, if the employee agrees.
Okay. Okay. Let's see here. In our policy manual, we have provision for overtime payments to exempt employees if disaster declared. Can we apply to FEMA for reimbursement for this?
Again, my understanding is at this point, no.
Okay. Looks like 2 left. If an employee voluntarily goes to another state, then returns and needs to quarantine for 14 days, can we say no to paid coverage?
Read that one more time.
If an employee voluntarily goes to another state, then returns and needs the 14 days quarantine, can we say no to paid coverage?
You know, we've had to tackle this issue a couple of times. You know, voluntary travel is a tricky thing to define because we had an employee whose elderly parents were out of state, needed to get back. She's an only child. I mean, it's voluntary in that she wouldn't have to go, but it was a family obligation. We have a lot of people who work in Williams County who have actually relocated into our area from across the country, and we've had a number of circumstances where people say it is voluntary, but man, I need to go. So we have, on a case by case basis, approved some of those circumstances, and dialogue with the employee is really more what it's about. We are following the governor's recommendation to have them isolate for 14 days. We are providing them the opportunity to work from home where that is mutually beneficial to both of us. And because we think that it meets the standards of a state or local quarantine or isolation order, because in fact, if they travel out of state and it meets the state health officer's definition of a hotspot, the guidance from the government would say they should isolate. We're allowing them to use the 80 hours then.
Looks like this is the last question. Not sure if you can answer this, but we had an employee retire 1st of March, and we're struggling on how and when to hire a new employee with the social distancing in play. Makes it really hard to train a new employee. However, we would like someone hired before the busy summer schedule. Any advice? I'm sure this is common for many other entities. What do you guys think?
Yeah, we've onboarded 3 or 4 new employees since we restricted access to our buildings this 19th of March. And I guess what we have come to accept is that when we do onboard those folks, and we think that it's a critical position to get filled, that we are going to have to risk some closer exposure, which you know, we just have a conversation with those folks to understand that the person who's doing the training and the person who's receiving the training are going to have to be in some circumstances closer than the CDC's requirement of 6 feet, and certainly are going to have to be together for extended periods of time closer than the 12 feet that the Department of Health would consider a close contact. But we've hired a social worker, we've hired a patrol deputy, we've hired a manager for one of our departments that really needed a manager. And so So we are accepting in those cases that we are choosing not to follow explicitly some of the best practices. And on the other hand, we are not hiring folks and bringing them on board if it isn't a critical position to fill.
Well, I think that wraps it up. Thank you to all of our presenters. Erin, if it's all right, I would like to turn it back over to you for any closing comments.
Yeah, I'll leave. Thank you. And again, as I mentioned in the beginning, this is very complex, and I don't suggest you create policies that are 150 pages long. What I would say this, and I've tracked the North Dakota Insurance Reserve, and by the way, thank you. They're helping put this on. I've tracked the liability claims, what I call in claims, where it's in-house, where you have an employee and employee relationship. When you look at the claims that the Insurance Reserve handles, very few cases do we ever have litigation with Fair Labor Standards Act, FMLA, because most of the time, I think if the employee feels like they're being treated fair by the employer, everybody wants to have a good relationship. Everybody wants to work. So we don't have, even though those are very complicated and you can come up with a lot of scenarios and theoretical problems, most of the time, if you treat people right, it's not going to be a big issue. So what I would leave everybody with is, again, this is super complicated. I'm more than willing to try to work through with your legal counsel and HR folks some of these issues. But at the end of the day, if you feel like if the employee feels like they're being treated right, whether the law says yes or no, most of the time everybody is on the same page and everybody gets along. So with that, everybody just be safe. Thank you. And we will look forward to seeing you on better days where we don't have to worry about this nightmare. Thank you.
Okay, sounds great. Thank you to Erin, Brian, Christy, and Helen, and of course to all of you for taking time out of your busy schedules to join us this morning. Please be safe and take care, everyone.